not so fluently. Today we're creating this video called Answering Your Questions. I do have special rubric for you guys, and this question is from Fatima. First of all, thank you so much, Fatima, for being authentic, for being realistic, because we're here to be real and be honest and help each other to grow and learn and be a better professionalist. And there is no better point to start by being honest with yourself. If you think that you're so great, if you think that you know everything, if you think that you're like the number one and nobody's like you, this is a wrong position to be at when you work as a medical interpreter. So I already admire you, and I am sure that you provide great services. As they say, bad things doesn't come alone. So I have write down all the, there is one question, but it's super long, all the comments of Fatima to respond to it. And whoever as you work as a medical interpreter, and sometimes you guys don't feel like you're perfect or that you're great, just stay cool, stay calm, because nobody is actually perfect. Nobody is actually 100% accurate. You can be 100% accurate on the meaning of something, on the meaning of the messages, but using exact the same terminology is not obligatory as long as you know the meaning. Here we're talking about if you don't know the meaning. Okay, if the provider says long, complicated terminology, this is the first question. So if the provider says long terminology, number one, which some company include when you present yourself, hello, my name is Fatima and I am your Arabic interpreter, please use short phrases. If they ignore that and they start reading something, I personally said, excuse me, ma'am or sir. This is the interpreter speak, especially if they go super fast with something, the yari yari yari, and they don't listen, they don't care if you take notes or whatsoever. So I said, excuse me, ma'am or sir. First of all, you start with apologizing for the fact that you interrupt them. It's so important to be polite, it's so important to be kind, because even if they had a terrible day, lately happened to me, a lot of providers really have a crush on their day because I have a sense of humor and they can smile a little bit, because sometimes also the patients are really out of their mind, and they have these unrealistic expectations that I understand as an interpreter, and they also understand that it's a cultural thing. For example, lately I had this call that somebody requests some reimbursement of a fee of interest rate for loaning them money, and they told her that this is not possible. Not only she had called 10 times previously, of course they can see it on the system, and she started being insulting toward me and telling me that interpreter didn't interpret correctly. I have been paying on time. Interpreter, interpret, do your job. So there would be really challenging calls, especially with people that have a lower intellectual development, that doesn't have as much as education, and they don't understand that it's not because you're gonna shout on me, I'm gonna remove this fee. If you use something, you pay for it. But there is these people that still believe that they have to receive things for free. Or they just don't care about the other side. They just want to talk forever. This happens very often. So, if the provider use long phrases, I am apologizing, number one, and then I ask her to be short. And sometimes, if this doesn't help, I also let her know that I do take notes while she's speaking. So she is aware, she understands how hard it is to write down, and when she knows that I'm gonna write down everything as she's saying, people tend to respect that because they know it's challenging. I am pretty fast with taking notes, especially if I take voicemails. But if they start, they didn't normally pause. They're thinking that you're a machine or something. Apologize, request politely, okay? If I don't know a word, let's say I hear a word, gastroenterology, and I don't know this word. Uh, this is how I interact. Excuse me, ma'am or sir, this is the interpreter speaking. Can you please explain me what this word mean? For example, lately happened to me with the word colostomy. I don't know if you know what colostomy is, but I didn't know. And so I asked, and they give me, I said, excuse me, ma'am, this is the interpreter speaking. Can you please give me a brief description of the word colostomy? I'm apologizing, I don't know the word. Just apologize, because they're having long days. Just have in mind, they're dealing with sick, suffering people. I don't interrupt people every phrase, but once they're done to say the phrase, instead of starting to interpret, I ask the question. Excuse me, sir or ma'am, interpreter need clarification of the word colostomy, for example, right? And this works pretty well. Okay, what if the patients also use different conditions and procedures very quickly that you don't know about? Okay, I will give you one tip here that always helped me in 5 languages. Normally, the patient use Latin or English words, for example, cholesterol or high blood pressure. They are very similar. So for me, let's say I have problems with cholesterol, high blood pressure, I have arrhythmia, I don't know what I have, low white blood cells. Let's say this is 4 words, 4 terminology, okay? So you would probably know 2 of them, right? And then let's say you interpret 2, you just write down 2 and then you couldn't hear the person. Oh goodness, this is the 3rd time that I'm trying to record this video, and I'm gonna keep doing it despite that my work phone is ringing. We're gonna wait for the ring to finish, because I hate to start something and keep it in the middle. Hopefully that this is gonna switch off my system. Normally after one call the system switch. Okay, here we are. So just remind them to speak slowly, because you have to take a note. If you need a clarification from the patient, you gotta say to the provider, excuse me doctor, this is the interpreter, I would need to clarify a few terminology, please hold on for me. Especially in Russian, I often encounter this, because there is people from Kazakhstan, Tajikistan, north, close to Korea, that do speak Russian, the Muslim people that speak Russian. There is Tajikistan, many countries that speak Russian, and they have a different term for the same word, basically. And some of them I don't know, which is fine. And I'm like, can you please use another word? Can you help me here? I am apologizing. With respect to their culture and their conditions, of course, no? Okay, the question number 2, what if you know that the provider and the doctor are waiting for you to find the word on your own? Okay, let's say that I don't know a word and I decide to look in my vocabulary. I address you and I advise you to use electronic vocabulary, because it takes few seconds to use it. If I work on one device, for example, I'm recording on this phone and I don't work on this phone right now, but let's say this phone is on and my second line is on, and then I have my computer. And my computer have online vocabulary, so it's medical. Every time I got a call, I have actually 5 vocabulary for the 5 languages. The moment that I hear is Macedonian, I will click on the Macedonian vocabulary and I will have the mouse ready there to type. I will tell you why, because normally in medical, if you put the first 3 alphabets of the word, she will pop out and you will immediately see a few meanings. So you don't need so long time to search. Never search in a paper. I do have a paper vocabularies here. Let me show you. And they're right here. Where is my studio? This is medical Spanish. I have a few medical, then I have Italian. I have a lot of those vocabularies, but I use it for my own pleasure when I have the time to study. Do not use paper vocabularies while you were working. Absolutely never. You should have another device to use as vocabulary. And I think this is so fundamental. If if you don't know, if you, let's say, you don't, your computer is off, this happens, okay? I'm just ask them. I don't look for my own and try to explain it to the target language. I'm saying, excuse me, ma'am, this is the interpreter speaking. May you explain the meaning of colostomy for the person? I know this is the Italian company. They're harassing me because if I don't answer one call, they keep calling me. I'm just gonna let it drop. Let's wait for this to finish. But so being, if you're under tension, you can always ask them to give you a simplified explanation in a few words. That's not a problem. The second part of this question is, what if you didn't hear them the first or the second time when they repeat something? How do you maintain cool? Okay, let's say the doctor will say, hello, nice to meet you. We're talking about colonoscopy here. The patient is getting ready, and you hear a lot of noises, especially if they do some procedure. You're gonna hear a lot of noises, beeping. You're gonna hear his pew, 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 his heart. Then you're gonna hear the alarm in the emergency. There will be many noises on the back, right? So it's normal you don't hear. Okay, let's say the first time you didn't hear it. You ask, excuse me, ma'am, this is the interpreter. Can you repeat? They repeat the entire phrase and you miss one word. So you said, ma'am, excuse me, can you spell the last word? Or I am saying normally, I missed the word after we're going to do. Can you please repeat for the interpreter? And always be apologizing. I'm apologizing for making you repeat, ma'am. And sometimes I said, there is a technical issues, there is a beeping, there is a lot of noises. I'm apologizing. I'm trying to do my best. If you get frustrated, they will be frustrated at you. So your vibe, it's what saves you here. So keep cool, like keep your vibe soothed and calm, okay? It's okay not to hear. It's happened. It's not your responsibility. It's not like you're deaf, or it's not your fault, okay? So don't feel guilty. Don't try to think about them waiting. Sometimes I would say, excuse, this is gonna be in the beginning. Excuse me, ma'am or sir, the interpreter is looking for a term. Please hold on, thank you. It normally takes me about 20 or 30 seconds. It's okay. I also said in let's say it's Russian, I said, извините, пожалуйста, момент. And they're waiting. They are like, okay, no problem. They understand that you're doing something. But if you just ghost for 20 seconds, they will be, hello, interpreter, hi, are you here? So just make sure you let them know. Interpreter is looking for terminology. Or, ma'am, can you describe this word for me? I find out that it's faster for them to describe it than you search for it. Honestly, I don't remember last time I searched for word. Maybe it was 3 months for colostomy. That's the truth. But I spent 4, 5, 6 years studying this terminology, and I feel pretty confident. And if you see my videos, I'm 95% I can find them. Sometimes I cannot, but normally I know what it means, right? The meaning. How to maintain cool? I have different tactics. One is watching outside the window. Yeah, I'm just watching something, a tree, an object, people moving, people walking. If they're angry, it's called disassociation psychologically. So you remove yourself from the situation by focusing your vision or something else. I keep taking the notes, yes. If they curse, I keep writing down. I said this word, F word, mother F word, father F word, in whatever words they use, I do it, but I disassociate from them. So normally, if the person curses for 5 minutes, I will write 1, 2 curse words. Then I will try 1, 2 minutes, give them time to keep cursing, and at the third minute, I will interrupt them and I will interpret until the cursing, and then I will say, interpreter is summarizing an appropriate language using curse words for the next 2 minutes and a half. Do you want me to go in detail? Most of the providers doesn't want you to repeat the cursing words. Sometimes when they do procedure and the patient say ah, f, and so on, this means that they are in pain. So I will interpret the cursing word and say this means that he is suffering and he's in pain or something is wrong. The most important part is to stay cool. Stay cool. I find out that if I draw, it keeps me distracted and it keeps me really calm. You can find out what is it for you that helps you. Or I watch something, I watch a picture, a painting, out the window, the weather, the trees. I like to watch the trees. Normally trees distract me. I don't know what works for you. If you have a puppy, you can watch a neighbor puppy. I don't know. There should be something that distracts you, keep you detached emotionally. I'm so good at, I think I become real good at this lately. Okay. Also, if you need help with this and how do you stay professional for complicated medical terminology, there's nothing wrong with need help. You gotta accept yourself. I mean, I think uh, I become more confident when I accept the fact that I will never know everything, that I will never be like doctor. I will never know exactly the whole procedure. I have a general idea, and I'm okay with that. It's all right. I am comfortable in my own skin. And I think that the people on the other side, they can perceive you vibe, they can perceive you calm, and they, yes, sometimes they scream, sometimes it gets really heat, they insult me, and the moment that they start insulting me, I'm apologizing and withdrawing from the call, right? So accept yourself. Sometimes they tell me that I'm a terrible interpreter, that they are so great, how dare I? Sometimes there is somebody that thinks that they speak and understand English and they try to correct the numbers that I say, which they think it means something else. And I'm saying, I'm so sorry, I'm apologizing. I did many years of training to do this job. And I repeat the translation. I say number 3 is, for example, tre in Italiano. Uh, and I'm saying, like, if you like, I can find another interpreter. Don't be desperate to stay there with somebody that will insult you and put you down. I find out that if you stay there and try to do something for someone that insults you, it's not good for you. It's not good for your self-esteem. You're not learning, you're not doing good job, because if somebody insults you on your work, you're affected. You are a human being. So respect is must. And also when I have to disconnect, when I choose to withdraw, I do it with respect. I say, I'm apologizing, ma'am. The person is insulting me and I don't feel comfortable. Give me a second, I will transfer you. And this is all right with the provider. I often say, I am not here to argue, I'm apologizing. Just at this moment, I have a blank in my head. Can you please help me? They understand. I'm apologizing. It's human. And yes, there is this nut cases that you're gonna have sometimes. Stay okay. It's okay. It's all right not to know everything. It's okay not to be perfect, right? Okay, found out a word on your own. Do not. Because sometimes the doctors mean something else. Okay? You don't know what the doctors mean. So I will, sometimes it's called Spanglish. For example, they call it Spanglish between Spanish and English when they use, I will use the same word in English on the target language. Let's say my terminology that I don't know, it's upper endoscopy. I will interpret everything. Okay, for example, let's say the doctor is saying, hello, Mr. George, we're going to do upper endoscopy today. So the first part will start with anesthesia. Here is the anesthesiologist who is going to start to explain you the procedure for anesthesia. And so I start. Allora, salve, buongiorno, Mr. Giorgio, siamo qui per fare la procedura che si chiama upper endoscopy. E questo è la specialista che sta per fare l'anestesia. Per favore, lo specialista di anestesia sta per spiegarti la procedura di anestetico. So I left the word in the original language. Except to the patient to ask, okay, what's upper endoscopy? Most of them, they already know the terminology and you don't have to sweat, be worried about. I know it feels bad when you don't know a word, but you can let it on the original language if you don't remember it, if you don't know it. And most of the time, a lot of the patients, they are like doctors, they know about their disease. So it's okay if you say it in English. I sometimes say it in English and I say, I'm apologizing. let's say in Russian. Простите, пожалуйста, я использовала английское слово, я это слово не знаю. I admit that I don't know it on the target language. I said, I'm apologizing, I'm not aware of this word. And they smile. And it's like, oh, it's okay, this is the word. I said, and I said, thank you very much. You guys helped me. I learned something from you. But also, in the end of the day, when I finish work, I will have this book where I write all the words that I don't know. And I find them in the 5 languages. Writing a word in the end of the day that you don't know, it repeat it in your brain and help you remember it, and you're gonna know it the next time. Okay, often ask questions. No, I do not ask questions at my interpreting work. This is not your job to ask questions. It's not. You're not there to ask questions. No, no, and no. I ask for a repetition. Can you please repeat, because I didn't heard interpreter speaking. Can you please repeat, because I didn't heard the word in English. Thank you. Then I ask for clarification or meaning. I say, hello, this is the interpreter. Can you please clarify for the interpreter, what do you mean by saying upper endoscopy? Can you clarify the meaning of this word for the interpreter, please and thank you. Short and sharp. Don't feel, if you start feeling uncomfortable, hello doctor, I feel so bad to ask you. I don't know what is this. Can you say to me, please? No, 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 no. You gotta ask sharp and short. Don't feel embarrassed. Don't feel guilty. Don't feel bad. Keep it short when you ask for work. Keep it short. Doctor will give you short answer. If you intervene is called literally properly. If you intervene properly, the provider will work with you. But if you're insecure and if you're afraid, this is gonna be transmitted in your work. And the provider will be bugged when you ask. You gotta feel so confident to ask a word that you don't know. It's like you're asking her to repeat. You gotta feel confident. You don't have to be afraid, ashamed, or feel wrong. There is nothing wrong with it. So the moment that you accept that there is nothing wrong with you having lack of knowledge, it's normal. This is when you're actually not gonna be afraid to ask about it, and you're gonna receive somebody who is happy to help you. The vibe that you put into it is very important. So we don't ask questions. We don't. Ask for repetition, yes. I think that the problem that you have, I can guess, because you just text me, you write me a comment, I can guess. I suppose the reason why you omit is because you take too much notes. Unfortunately, I can tell you, I come from simultaneous where I barely take any notes, and when I start to do consecutive as medical, I would try to take as much notes as possible because I was feeling insecure and I didn't trust myself. So I will advise you to take less notes, just a word or two. If I work 6 hours, let's say I work 6 hours, I will probably have one page. Let me show you. If I speak 6 hours, I will have 1 page like this on the both sides, 6 hours consecutive. Little to minimum notes, very, very, very minimum. And if you look my notes, that will be numbers, names, and some words. That's it. Not, if I have to spell something, I would normally have a habit to write it down just to make sure that it's correct, like a name or something like that. But don't take so much notes. I always know that the doctor greet them. And if they ask, how are you? I just write the interrogative point, and I already know that they ask how the patient is. How are you feeling today? It's simple, right? So try to trust yourself. I hope this video was useful for you, Fatima. Thank you for being here. Thank you for your questions. Please be my guest. I want someone to come and speak languages with me. Thank you and have a good day. Bye bye.